Imagine walking into your doctor's office for a typical routine checkup, something that your insurance has previously covered in the past. You leave lighter, happy to know that your doctor said nothing is wrong. Yet, a few weeks later, you receive an invoice in the mail for over $1,400, all because your insurance company decided that part of your yearly checkup wasn't medically necessary, even though your doctor thought it was. This might sound like a nightmare, but this is the living reality for a woman named Carmen Aiken, Chicago. And the scariest part of it all is that she's not the only one. My name is Sophia Saunier. Today I want to talk about a serious issue affecting the American healthcare system. The fact that it is insurance companies dictating what is and what is not medically necessary, when it should be doctors that know their patient and their histories and bodies. Every year, insurance companies deny millions of people the care that they need. According to healthcare.gov, nearly 1 in 5 in-network claims were denied as recently as 2023, and less than 1% of those cases even get appealed. Insurance companies decide what is medically necessary based on a variety of factors. One of the biggest factors is cost. And this is how they line their pockets, by rationing out care to maximize their profits. The words medical necessity are defined not by the doctors that treat their patients, but by the insurance companies who benefit from denying them care. So, why do the insurance companies do it? The simple answer is corporate greed. In 2022, Cigna Health, an American healthcare organization, denied over 300,000 cases in just 2 months, spending less than 2 seconds on average reviewing each case before denying it, saving the company millions of dollars in the process. How is it right that insurance companies can make a decision in less than a breath that could alter a patient's lives forever? The companies claim that they have the people's best interest in mind, but when your doctor recommends a medical treatment and your insurance company denies it, who do you trust in more? The trained physician or the company accountant? Let me give you a few stories just to cement how real this issue is. A woman named Kathleen Valentini was suffering from severe pain all across her body and decided to go to her doctor. Her doctor was a man who said she needed to get an MRI. She sent over the request to her insurance, and it was delayed for over 40 days. By the time it was approved and she was able to get her MRI, it was too late. She had cancer metastasizing all over her body rapidly. She had to get all her limbs removed, and still, it wasn't enough. She later died. Another woman, Natalie Sorinskan, was just 17 when her doctors at UCLA told her that she had to get a liver transplant. Cigna Health, once again, denied this woman the claim and only reversed their decision after there was public outcry. Once again, it was too late. Madeline died just hours after the appeal. These are not just accidents. This is a result of a system designed with profit in mind, not health. The biggest kicker of it all is that the financial impact of insurance denials doesn't just harm the individual families. It burdens our entire healthcare system. According to the Commonwealth Fund, over $250 billion is wasted each year on administrative red tape tied to insurance denials and pre-authorizations. $250 billion that could be used to hire more doctors, shorten ER wait times, or even expand medical care in rural areas. Meanwhile, the American Medical Association, or AMA, reports that doctors spend more than 13 hours a week battling insurers just to get their treatments approved. Hospitals are forced to dedicate entire teams to these denials, draining resources that could be used better on nurses, mental health services, and actual patient care. It's not just frustrating, it's deeply wasteful and unsustainable. So, after all hearing this, what can the little people like you and me do to fight against these injustices? In California, there's a proposed Senate bill, Bill 363, that would heavily fine insurers for wrongful denials. And if we alert our own government officials, maybe one day we can have a bill like that too in Louisiana. Change starts at the individual level, and it is up to the citizens of America to fight for their health. In a world where insurance companies can decide your fate without ever seeing your face, we must demand that expertise and not profit guides our healthcare system. Insurance companies were not designed to be doctors, and therefore should not be treated as such, and they shouldn't be controlling a sick person's treatments. The longer we act like they should be able to, the more people suffer. And I think we should change that. Thank you.